I'm Rachel. I'm going to be your student nurse for the day. Right now I'm just going to explain that I'm going to be doing your dressing change for the day. Right now I just want to verify the size and the location of your wound. And it's about medium size from what I can tell from the old dressing. And it is on the abdomen, so it's an abdominal wound. And if the patient was experiencing any pain, I would ask them if they were experiencing any pain, and I would give them the proper medication 30 to 40 minutes prior to the dressing change. So now I'm going to make sure that I have all the supplies I need in order to do the dressing change. I have hand sanitizer for whenever I need to change my gloves and re-sanitize. I have my poly linen drape, my suture removal set with forceps, my cotton tipped applicators. I have my sterile gloves, my ABD pad, my tape, my dry gauze, my 4x4 gauze, my saline, my biohazard bag, and normally I would have regular gloves too, but in this situation I'm just going to pretend like I'm putting regular gloves on. Right now I'm going to sanitize. Okay, and I will be putting on a pair of clean gloves. Okay, and so I'm going to re-enter the patient's room. Hi, I'm Rachel. Again, I'm going to be your student nurse for the day. Can you go ahead and verify your name and date of birth for me? And I will check it on their wristband to make sure it's right. Okay, and then can you verify any allergies you have for me? Okay, great. And I will also be providing patient privacy while I undo the old wound so that there's no one looking around and looking in. Okay, so I'm going to start by removing your old wound, but at first I'm going to raise the bed to waist height. Okay, so the bed's at waist height, and I'm going to hold the skin while I remove the tape from the wound. Okay, and now this side. Okay, and so I'm going to lift the dressing away from the patient's head, which is on this side, and I'm going to note that there is no signs of infection or swelling. The wound is red and moist, the skin is clear, there's no odor, so that's great. And I'm also going to count the gauze real quick. 1, 2, 3, 4. Okay, and I am going to dispose of this in the biohazard bag, which I'm going to cuff also, so that it's easy access. I'm going to toss this in there. Okay. And normally I would do the biohazard bag before I did the dressing change, but for this case, I just went ahead and did it now and put the old dressing in there. Okay, so now I'm going to take off my old gloves and dispose of those also in the biohazard bag. And I'm going to put on my hand sanitizer again and put on a clean pair of gloves. Okay, so now I'm going to make sure I have a clean, flat, dry surface in order to lay out my poly linen drape and put all the materials on it that I need in order to do the clean dressing change. So I'm going to start by opening my drape, and I'm able to touch the blue outside, but I cannot touch the inside, but I am also able to touch the outer 1-inch perimeter of this. So in order to stay sterile, I am going to do this. Okay, so I'm gonna now grab the outer 1-inch, and I'll make sure not to touch the table. And I'm going to lay this on there without contaminating. And normally I should have gone like this to do it so that there's no signs of contamination. So I have this down, I'm still touching the outer 1-inch. And I'm going to put all of the products that I need on here that need to remain sterile. I have my, normally this package would be closed and the things wouldn't be falling out, but I have my cotton tipped applicators, which I'm just going to toss on there. And I'm going to dispose of this in the biohazard bag. I will make sure not to go over the drape in order to contaminate it. And like I said before, the cotton tipped applicators normally wouldn't be open, but since I've been practicing before, one of them happened to fall out, so I would dispose of those and get new ones. I also have my sterile, or I have my suture removal forceps, so I'm going to toss those on there. Dispose of the bag. I have my ABD pad. And I also have my dry gauze. And I do need to make sure I do not cross the polylinen drape in order to contaminate. So when I was doing that, I had to make sure that I stayed behind it. For right now, I am going to leave the 4x4s, the saline, the tape, and the sterile gloves out here because they do not need to be on the polylinen drape. I'm going to open my gauze without crossing the opening. So, okay, so I'm going to pull back on the lid and tuck it under the gauze so that there's no sign of contamination. And I will also be pouring the saline on those gauze in order to do the dressing change. Okay, and so now I'm going to dispose of my old gloves and put them in the biohazard bag, and I'm going to reapply hand sanitizer. Okay, and now I'm going to open my sterile gloves in order to start the procedure. So I'll open them carefully so that I am not contaminating. Okay, so in order to stay sterile, I'm going to don my right glove. So I'm going to grab the inside of the glove first so that I'm not touching the outside. And I will carefully place my hand in there, making sure not to touch the outside of the glove with my left hand. Okay, and I'm going to carefully pull this down so that I still don't touch the outside. And so now that this glove is sterile, I can grab any part of this glove in order to put it on. And so I'm going to do that and then just pull this down. Careful not to touch any part of my hand or my skin so that doesn't cause contamination. Okay, and so this I'm just going to throw on the ground for right now because we don't need it. And so now I'm going to start with the clean damp to damp process. So I am going to take my forceps and I'm going to grab a piece of gauze from the 4x4 and wring it out if it needs it. Okay. Grab it again. And now, I still need to make sure I don't contaminate by crossing over. And so I'm going to start in the center of the wound and clean it down the middle with one gauze, and then I'm gonna dispose of that in the biohazard bag. And then I'm going to grab a second gauze out of the 4x4 and also squeeze that out if it needs any. So now I'm going to wipe the outside of one of the edges with that gauze. Okay, and so I'm going to dispose of this one into the biohazard bag now. And since this touched the biohazard bag, normally I would grab a new one, but for the video, I am just going to keep using this, but just so it is known. And so now I'm going to grab the third one and wring it out if it needs it also. And I'm going to wipe the last outer side of the wound. And I will also dispose of this in the biohazard bag. Okay, so now that I'm done cleaning, I will be taking the 4x4 sterile gauze and stretching them out in order to put inside of the wound. So I do not need the forceps anymore, so I'm going to put those in the biohazard bag. So I'll be stretching these out, doing this. Then I will use the cotton-tipped applicators, which I'll be careful not to cross too much. I'll be using the cotton-tipped applicators to push this inside the wound carefully. Okay. And I'm going to dispose of this cotton-tipped applicator. And now I'm going to get a new gauze. Okay, well that one's going to be disposed of. I'll grab that in a second. But now I'll get a different one. And I'm going to do the same thing that I did with the first gauze, and I'm going to wrap it. And then I'm going to use the second cotton-tipped applicator in order to get the rest of the wound covered. Okay, so I'm going to make sure that all of the wound is covered with the sterile 4x4 gauze. I'm going to dispose of this cotton-tipped applicator. And now I am going to place the dry gauze on top of this wound. Okay, so I'm going to put one right there and one right there. I'm also going to note that the wound was also still red, still moist. There's still no signs of infection. There was no odor. And I am going to apply the abdominal pad last, and the side with the blue line will go on top. So I'm going to place that on top of the wound, and then I'm going to grab the tape and carefully take apart 3 even pieces of tape. To place on the wound. Okay, and once that is done, I will sign the tape with my initials, the date, and the time. I will again verify and document the size, location of the wound. I will write down if the wound was red and moist, and if it had any odor, which it did not. I would also make sure to verify the patient's response to the wound cleaning, the wound change. And lastly, I will make sure I carefully remove these gloves. And dispose of these in the biohazard bag. And to finish, I will re-sanitize my hands to make sure they're clean. And I will dispose of any products that I used into the biohazard bag. And that is the end of the daily humid to damp, when to change. Good.